Now, managing muscle and joint pain as well as injuries can be quite challenging. So we've invited Dr. Jacquelyn Schultz, a homeopath, into studio to chat to us about how to effectively deal with muscle and joint pain, as well as the effective ways to treat them both. Jackie, let's start with just sort of what is the difference between muscle and joint pain? Because sometimes we feel aches and pains and we don't quite know where they're sitting.
So anatomically, our muscles are going to connect us and allow our limbs to move by contracting and expanding. So muscles constantly need to contract and expand, but they can get injured. Joints are where the two bones meet.
Right.
So essentially, like your arm is a hinge joint, your leg is a hinge joint, your hip. And those joints can become inflamed due to injury or illness.
Okay.
But they very distinct different parts of the body with distinct conditions.
Sometimes it's difficult to say, is it a muscle pain or a joint pain? It's an ache, it's a pain, so people kind of just sort of muddle their way through. So are there distinctive characteristics of each one that would be indicative of what it is?
I don't know if I'd go distinct characteristics, I'd more go where is it? You can't have a joint pain in the middle of your arm.
Obviously, yeah.
So there we're going to assume it's more muscle, but this is where we use our investigation. So if we're concerned about a joint issue, we're going to recommend an x-ray because we're able to tell if there's a level of osteoarthritis, and their blood test if there's a concern about rheumatoid arthritis, which is a more systemic autoimmune condition.
Right.
Also, we've got our specialists like physiotherapists and that chiropractors who will assist in working out whether it's a joint or muscle pain. But for the average person, we want to treat what the issue is, almost not irrelevant whether it is joint or muscle, but we want them to be able to reduce their pain and their inflammation if there is any bruising there. But usually I say to patients, if it's over the area where the two bones meet, it's most likely going to be joint. It can include muscle.
Yes.
If it's in the middle of a limb, or it's in your neck area in the front, not in the back, it's probably going to be more muscle.
Okay. So now there's obviously two sort of fairly distinct reasons for muscle or joint pain. One would be overuse, one would be an actual injury or a bit of damage from it. And then there's also, I imagine, age-related aches and pains as well. How would one prevent the onset of aches and pains, or what can we do to prevent them from becoming inflamed, damaged, and hurting?
I think a lot of the time it's going to be being mobile. People have to be mobile. Being seated all day is terrible for us. Obviously weight plays a role. The heavier you are, gravity is going to play a role in those joints.
Right.
What we eat makes a big difference.
Okay.
And then there is supplementation. We know omega-3 oils are really important to literally oil from within. But also it's addressing the problem the minute you experience it. It's not waiting. Oh, I've left it too long.
Okay.
And that's what we want to rather try to do.
Right. People who maybe want to get mobile, start moving. I mean, often people get scared because they start moving and then everything hurts and then they back off again. So is there a sort of a cycle of recovery that people should keep in mind if they suddenly are becoming mobile, feeling these aches and pains, but to not let them give up because of them? How do you manage that pain?
Well, you bring up a great point, because what also happens is a lot of people are very active, be it in the gym, on the road, rebounding, and then they stop for a period of time, whether it's illness, getting out of routine, and then they assume they can just go back to their previous level of exercise.
Yes.
You can't. You have to build it up again, because you literally don't want to create damage to your muscle fibers. They contract, they relax, they have to recover. So usually we'll say to someone starting out again, it's more important the fact that you're doing it 2 or 3 times a week for a short period of time, but consistently, an hour, hectic, intense exercise once or twice, even a day or a week. And you have to build it up slowly, but the important thing is it becomes part of your lifestyle. You're going to maintain it, and then it becomes easy for the person.
If you're injured, that's quite a different thing in terms of recovery compared to stiffness from use and that breaking of the muscle to build it. So what's the balance there to say, right, it's a use stiffness versus an injury pain? How do you maybe identify that to manage the recovery process?
You said it already, it's pain.
Okay.
So if you've got pain is a signal to us to go, something's wrong.
Right.
So, inflammation, pain, infection, can be a problem. Inflammation in its acute form is fantastic. It actually allows recovery of the area. Inflammation in the chronic form is terrible because it's going to cause a chronic issue and deterioration.
Okay.
So I think the inflammation is what you were speaking about, the stiffness. It's kind of the good feel in an acute form. Chronic form, it's not good, and that's our osteoarthritis patients.
Right.
So we always want to try and bring down pain, inflammation. If there's any bleeding and bruising in the area, you want to address that as well.
Okay.
But you should not be in pain.
Right.
Pain is not good.
Okay. So now, Jackie, if we've got some of the stiffness, sore, pain, muscle tenderness, joint tenderness, what are some of the things that we can do that are going to relieve that pain and help with recovery?
So from a lifestyle perspective, ironically, you need to keep moving. That way, you're going to actually get relief and not more pain.
Okay.
But each person has to ascertain, what have you done? So if you have damage, so if you've sprained a ligament or a tendon, you have to rest it, you have to ice it, sometimes compress it, even elevate it if necessary. So you need to decide what's wrong. But the minute you feel that discomfort, you need to stop and address how bad is it, and then do something to treat it.
Okay. So what would you maybe suggest in terms of treatment? I mean, always with pain, and bruising or muscle pain or whatever, arnica is something that I think a lot of us know about. What is your sort of thought around arnica, and how helpful is it?
So arnica is probably one of the most well-known homeopathic medicines. It's a remedy par excellence when it comes to inflammation, pain and bruising. So much so that it's one of the remedies I think non-homeopathic practitioners will immediately think of, particularly for post-operative recovery, because of the anti-ecchymotic, that's the anti-bruising effect.
Okay.
So arnica, when it comes to any sports injuries, inflammation is fantastic. So we usually recommend patients, anything muscle related, arnica is your immediate go-to because it's a muscular tonic as well.
Okay.
So we want to apply it to the area. If you're applying it topically, you can take it orally as well, but apply it topically as long as there's no broken skin or you're not allergic to the arnica component itself. That's the route we want to go.
Okay. And where does arnica actually come from?
So arnica is a plant,
Okay.
and there are different preparations available. For me, I want the cleanest preparation without any other ingredients. So I tend to use a product called Arnigel. Reason being, in Arnigel is only arnica. There are no other active ingredients and there are no other remedies.
Right, right.
Another important thing is that when you're applying something, I'm very texture defensive and tactile defensive. So one of the reasons I'm also going to choose the Arnigel perhaps over other particular arnica topicals is it doesn't give you a greasy, sticky feel because it's got a hydroalcoholic base. I really appreciate the fact that I can apply it and it instantaneously is absorbed into the skin and it doesn't leave that greasy, sticky feel. It's also got such a clever application in the sense that being a hydroalcoholic base, there's no menthol in there, but as the alcohol is drying off the skin, it gives a very good cooling effect.
Okay,
so when there's inflammation there, it really cools it down. So I would usually recommend to my patients, particularly if they are athletes or they're in the gym a lot or they play a lot of sports, is to keep something like Arnigel with them, because the minute they feel, I think I might have tweaked something, to apply a thin layer over it, because the sooner you address the issue, the quicker you're going to get recovery.
Okay, okay. So something like Arnigel, I mean, what, topical obviously, sports injuries, things like that, what else would you be looking at using it for, or would it be good to use for?
So if we go back to what is in Arnigel, it's Arnica montana. And Arnica montana is always pain, inflammation, and bruising.
Okay.
So anytime, whether that's from injuries, falls, contusions, sports injuries, we're going to apply it. But a big application for me with patients is also osteoarthritis, because they have a lot of pain and inflammation, as we spoke about the joint pain earlier on.
Right.
But we always want a safe approach for the patient medication-wise where we're not doing harm. And unfortunately, your conventional anti-inflammatories do come with a risk of kidney damage, affecting the urea levels, as well as stomach lining gastritis and risk of ulcers. So the thing for me is I can safely recommend something like the Arnigel, whether in conjunction with any other medicine is fine, but I know I'm not complicating a health issue.
Okay. And then once you've got the pain or the injury that you're dealing with, how often should you be applying the arnica? Is it something that you should be doing every couple of hours, once a day? What's the sort of treatment regime?
So I usually say to a patient, if the minute you spot that something's not right there, apply 3 times a day until you feel better.
Okay.
And then you can reduce the applications to once a day.
And Jackie, is a product like Arnie Gel, is it something that anybody can use?
It can be used on any age as long as that skin's not broken.
Okay.
So very often you've got moms using it for their kids with the bruises, the knocks, especially little kids as they're learning to walk and that wipe out a lot. So it's a fantastic quickie to apply to that kid. It doesn't hurt to apply. There's no burning when you apply it to the skin. It can be used by all ages. It's not contraindicated with any other conditions or medicines.
Okay.
So it's a really good one from that perspective as well.
Great. And is it something that's freely available over the counter?
It's made by Boiron, which is our largest homeopathic manufacturer in the world. So all leading pharmacies, health shops, your homeopathic practitioners will be available quite easily.
Wonderful. Jackie, thank you so much. Some great insights there around sort of recovery, muscle pain and things like that. So thank you for sharing your very fascinating insights.
Thank you.